shoulder dislocation and active assisted movements, stroke patient and positioning. We all want that our patients gets better recovered. And my dear friends, this week questions were about these two conditions and I'm here to answer both the questions. So talking about this week's first question, which was about that a therapist is preparing home exercise protocol for a patient who had anterior shoulder dislocation on the left side and it has been 3.5 weeks, and now we want to see which exercises will be working best for the patient. Options given are that can assisted flexion, can assisted abduction, can assisted external rotation and can assisted internal rotation. Now we come to know that all the exercises are active assisted, but we have to make sure that which is the best one. And we know that anterior dislocation means external rotation and abduction must be avoided to avoid the recurrent dislocation in the anterior side. So these two options are already removed from the answer. Remaining options are active assisted flexion or active assisted internal rotation. Now guys, internal rotation or external rotation both can be dangerous whenever we talk about the dislocation. Especially external rotation, I already told you it is dangerous because it puts humeral head in the anterior direction, as well as internal rotation when it is in neutral position assisted with the stick also can be difficult for the patient, or it can cause certain abnormalities for the anterior dislocation of the patient. But in place of that, if we notice flexion with active assisted, which is can assisted, can cause no issue with the shoulder range of motion, as well as it cannot cause recurrent dislocation of the shoulder. And that is why this is going to be the right answer for this question, which is option A, can assisted shoulder flexion. One more thing I want to mention here is, please, if you're liking this series, please give your more and more love so that I am more and more motivated to give more questions in every week. Okay, talking about the second question, guys. Second question was about the acute stroke patient. In acute stroke patient, we have to find out which will be the best position to give for the patient. In options, we have got two positions which are in supine lying position and two positions which are given in the side lying position. We will discuss about this later, but let's first discuss what is our priority when we are treating a stroke patient or we are positioning a stroke patient. So our number one priority is that any structures around the shoulder, like ligaments, like joint, everything should be preserved properly. It should not be given more stress on the ligament, or it should not cause any subluxation or dislocation of the shoulder. Second thing to take care is that we know that any stroke patient is going to develop a synergy. So we have to make sure that whichever the position we make patient lie down should not be in the synergy pattern, so that we can ignore or we can lessen the spasticity level. Now here, first option we are given about a supine lying position. We know that supine lying position with shoulder flexed and arm kept on the we can say tummy. This is a typical position in which a synergy can be developed, so that option is incorrect. Another option given for supine lying position is that keeping patient's arm in supine lying position by side of the trunk. Now again, this is a typical position which patient will develop in extensor synergy. So this also cannot be correct. Another two options which we are given in side lying position are, one option is that shoulder and arm is kept overhead like this. So this position also can be critical because this can cause stress on the ligaments and also might cause subluxation or dislocation of the shoulder. So this position can be incorrect. And the last position in side lying position which we are given is keeping shoulders protracted. Patient is lying on the good side, side lying position, and keeping the shoulder protracted, also elbow straight and also supported with the pillow. So we are maintaining the abduction as well as we are maintaining the extension of the shoulder, and that is how we can preserve the movement. We can ignore, we can avoid more and more spasticity for the patient. That is why this option will be the accurate one, which is the option B for this answer. So guys, I hope you have understood the question as well as answer for the question. And if you still have any doubts, please let me know in the comment section. I will always be very happy to help you all. Till then, take care of yourself. See you all next week with more answers and more questions.